The question here, the nurse is planning dietary changes for the client following episode of acute pancreatitis, means the inflammation of pancreas. Which diet is suitable for the client who have acute pancreatitis? So, number one, low calorie, low carbohydrate, high calories, low fat, high protein, high fat. Number D, low protein and high carbohydrate. The correct answer is number B, right? Say which diet is suitable for the client. So, high calorie but low fat diet, it's suitable for the client. Why? So the client is recovering from acute pancreatitis or pancreatitis, and the client needs a diet that is high in calorie and low in fat. Answer A, answer C, and answer D are incorrect because they are increase the client discomfortness. Next question, a client is admitted with a diagnosis of polycythemia vera. The nurse should closely monitor the client for what? So keyword is polycythemia vera, right? So number A, increase blood pressure. Number B, decrease the respiration. Number C, increase urinary output. Number D, decrease oxygen saturation. The correct answer is increase the blood pressure. So it is important to monitor the blood pressure, closely monitor. So why blood pressure monitor is important? The client with polycythemia vera has an abnormally increase in number of circulating red blood cells that result in increase the viscosity of blood. So when total number of WBC increase, blood volume increase, blood viscosity increase, patient chance to develop high blood pressure. So increase in blood pressure, further factor, important factor to monitoring, because increase in blood pressure further takes the overwork the heart. So it is important to monitor. The answer B, C, and D do not directly related to this condition, polycythemia vera. So they are incorrect. Next question here. A client with hypothyroidism. So this is a keyword. And frequently complain of feeling cold. The nurse should tell the client that she will be more comfortable if she, number A, used an electric blanket at the night. Number B, dress in extra layer of cloth. Number C, applied a heating pad to her feet. Number D, takes a hot bath morning and evening. The correct answer said number B. So It is good to tell your patient dress in extra layer of cloth because hypothyroidism complain of cold. So the dressing in extra layer of cloth will help decrease the feeling of being cold that is experienced by the client with hypothyroidism. So decrease the sensation and decrease the alertness are common in the client with a hypothyroidism. Let me recap it. The patient who have diagnosed hypothyroidism, that their sensation or alertness also decrease. As I told you, decrease the sensation and decrease the alertness are the common in the client with hypothyroidism. So when we use the electric blanket, if any burn occur, any damage occur, they will not understand it. It's because of sensation reduce, alertness reduce. If you apply the heat pad, maybe it causes burn, but patient will not understand. Like take a hot bath, sensation is reduced. Too much hot water can causes the blister formation, but patient will not aware about that. So it is good not to go. So the use of electric blanket or heating pad can result in burn, and making the answer A and C is not correct. And answer D incorrect because the client with hypothyroidism has dry skin, and also a hot bath morning and evening would make her condition worse. So we prefer answer B. And next question here. The nurse caring for a client with a closed head injury obtain an intracranial pressure, shortly called ICP, reading of 17 millimeter of mercury. The nurse recognized that. So the keyword is here, head injury, right? And intracranial pressure is elevated and the doctor should be notified. Number B, intracranial pressure is normal, therefore no further action is required. Number C, intracranial pressure is low and the client need additional IV fluid. Number D, intracranial pressure reading is not as reliable as the Glasgow Coma scale. The correct answer is number E, means the intracranial pressure elevated. And the doctor should be notified, right? It is because it is 17 millimeter of mercury. So every student must know what are the normal intracranial pressure. Means the pressure inside the brain by cerebrospinal fluid. So intracranial pressure is 17 millimeter of mercury should be reported to the doctor because it is elevated. The intracranial pressure normally range from 4 millimeter of mercury to 10 millimeter of mercury, with the upper limit is 15 millimeter of mercury. So answer B is incorrect because the pressure is not normal. So It is not normal. So B is not an answer. Answer C is incorrect because the pressure is not low, right? And answer D is incorrect because intracranial pressure reading provide a more reliable measurement than Glasgow Coma scale. So answer A is correct. Next question. A client has hospitalized with a diagnosis of laryngeal cancer. So this is the keyword. My patient has a laryngeal cancer. Which factor is most significant in the development of laryngeal cancer? Number A family history of laryngeal cancer, chronic inhalation of noxious foam. Number C, frequent straining of the vocal cord. Number D, a history of frequent alcohol and tobacco use. The correct answer is number D, right? Book laryngeal cancer is related to the risk factor of tobacco abuse, alcohol abuse. So a history of frequent alcohol intake or tobacco use is the most significant factor in the development of cancer of the larynx. We call laryngeal cancer. So number A, number B, number C are also the factor in the development of laryngeal cancer, but they are not the most significant because the question said most significant, right? So let me recap it. As I told you, a family history of laryngeal cancer, chronic inhalation of noxious foam, and frequent staining of the vocal cord are also the factor in development of laryngeal cancer, but they are not the most significant. Therefore, they are incorrect. The most significant causes tobacco abuse and alcohol abuse. The nurse is completing an assessment history of a client with pernicious anemia, which complaint differentiate the pernicious anemia from other type of anemia. So, question talking about the pernicious anemia. So, how you differentiate pernicious anemia from other anemia? Number A, difficulty in breathing after exertion, numbness and tingling in the extremities, a faster than usual heart rate. Number D, feeling of lightheadedness. The correct answer is numbness and tingling sensation in the extremities. So numbness and tingling in the extremities are common in the client with a pernicious anemia, but not those with other type of anemia. So answer A, answer C, answer D are incorrect because they are symptoms of all type of anemia. So question 19, a client with rheumatoid arthritis, a client with a rheumatoid arthritis is beginning to develop flexion contraction of the knee. The nurse should tell the client to Number A, lie prone and let her feet hang over the mattress as. Number B, lie supine with her feet rotate inward. Number C, lie on her right side and point her to downward. Number D, lie on her left side, allow her feet to remain in a neutral position. So correct answer is lie down prone, means lie on the abdomen and let her feet hang over the mattress edge. So this is the correct answer. Because when you're lying down, prone position, and allowing the feet to hang over the end of the mattress will help to prevent flexion contracture. The client should be told to do this several times a day because it is helpful for the patient who have rheumatoid arthritis. The answer B or C and D do not help to prevent flexion contracture. Therefore, they are incorrect. Next question. The chart of a client with schizophrenia. So our patient diagnosed the schizophrenia, and that the client has echolalia, one of the characters of schizophrenia. The nurse can expect the client is number A, speaks using word that rhythm, repeated word or phrases used by other. Number C, include irrelevant details in conversation. Number D, make up new word with the new meaning. So actually, examiner asking what are the meaning of echolalia, right? So correct answer is number B, means repeat the word or phrase used by the others. So if you say cat, they will say cat. If you say dog, they will say dog, and they can repeat it again and again. So the client with echolalia will repeat the word or phrases used by the others. The answer A is incorrect because it referred to the cling association. Speak using word that rhythm. Answer C is incorrect because it referred to the circumstantialities. And number D is incorrect because it referred to neologism, means make a new word with a new meaning. Nobody can understand except patient. We call neologism. Question: the mother of a 1-year-old with a sickle cell anemia, right? Want to know why the condition did not show up in the nursery. The nurse response is based on the knowledge. What? Number A, there is no test to measure abnormal hemoglobin in the newborn. Number B, infants do not have insensible fluid loss because a year of age. Number C, infants rarely have infections that would cause them to have a sickling crisis. Number D, the presence of fetal hemoglobin protects the infant. So the correct answer is number D, right? The presence of the fetal hemoglobin protect the infant. So this is the answer who have a sickle cell anemia. So the presence of a fetal hemoglobin until about the 6 month of age protect affected infant from episode of sickling. Right? So presence of fetal hemoglobin protect infant up to the 6 month. So the answer A is incorrect because it is an untrue statement about the sickle cell anemia. There is no test to measure abnormal hemoglobin. It's not correct. Number B. So answer B is incorrect because infants do have insensible fluid loss. So it is not true. Number C is incorrect because respiratory infection such as bronchiolitis or otitis media can cause fever and dehydration, which cause the sickle cell crisis. So infant is very uncommon have infection that would cause them to have a sickling crisis. No, it is not true. So I said respiratory infections such as bronchiolitis or otitis media can cause fever and dehydration, which cause sickle cell crisis. Next question. Which early morning activity help to reduce the symptom associated with rheumatoid arthritis? Which morning? Number A, brushing the teeth, drinking a glass of water, holding a cup of coffee, and also number D, brushing the hair. So early morning activity helps to reduce the symptom. So correct answer is number C. So why number C is the answer? So holding a cup of coffee. So coffee is hot or cold? It is hot. So when you hold the coffee, hot coffee, the warmth from holding a cup of coffee or hot chocolate helps to relieve the pain and stiffness in the hand of the client with a rheumatoid arthritis. So answer number E, number B, or number D do not relieve the symptoms of rheumatoid arthritis. Therefore, they are not the correct answer.